Hello and welcome to another program of Health Matters, a presentation by the Ministry of Health. Today we've got with us members of the Drug Demand Reduction Unit of the Ministry of Health, and we'll be talking about International Day Against Drug Abuse and Illicit Trafficking. In the late 1980s, the General Assembly of the United Nations decided to observe June 26 as the International Day Against Drug Abuse and Illicit Trafficking, as an expression of its determination to strengthen action and cooperation to achieve the goal of an international society free of drug abuse. And I've got with me Dr. Travis Freeman. He's a project director of the Drug Demand Reduction Unit. Miss Avril Brand, she is the Senior Prevention Officer, and Mr. Wayne Hunt, a National Trainer of Drug Treatment. Ladies and gentlemen, welcome to the program.
Thank you.
Dr. Freeman, I'll start with you. Give us a little insight, a little overview as to your unit, the Drug Demand Reduction Unit.
Thank you, Nazim. Thank you for having us. So the Drug Demand Reduction Unit is under the Ministry of Health, and we are mandated to provide drug prevention, drug treatment, and drug rehabilitation services. Mm-hmm. So the Drug Demand Reduction Unit works with other partners, other stakeholders in addressing the drug situation. As the name indicates, we work particularly in reducing a demand. This basically means we want to work on reducing the incidence in which persons misuse drugs, or what we refer to as psychoactive substances.
We're seeing a lot of stories in the media. What is the current trend here in Guyana right now?
So, yes, we've been seeing a lot happening in the media and a lot of persons misusing substances, and it has a lot to do with the pandemic and other issues or other crises. Hence, this year's World Drug Day theme is addressing drug challenges in health and humanitarian crises. We've noted that they've had an increase in persons experimenting and misusing substances, and oftentimes this is some form of a coping mechanism for individuals, and also persons are experimenting for the first time. We've noticed trends with particular substances. More recently, we've been hearing about the methamphetamine or MDMA, the street name Molly, sometimes referred to as ecstasy. So that seems to be the trending drug now, particularly amongst our younger population.
Yeah, but of course, the whole idea of drug runs, a whole spectrum. In some countries, they would say alcohol is the issue. For the clarity for viewers and listeners, is alcohol one considered a drug, and what is happening? We know, again, in the media we've seen crashes and accidents and so forth. What's happening there?
Yes, so alcohol is a drug. Mm-hmm. Alcohol is a psychoactive substance because it influences one's behaviors and one's attitudes, right? So it is a drug. In Guyana, alcohol use has become somewhat of a social norm, and persons would sometimes say it's a part of our culture. I beg to differ. I don't want to say alcohol is a part of our culture, but it's definitely a social norm and one that we need to change.
But you, Doctor, are you seeing abuse there?
Yes, definitely. We've been noticing.
Because you spoke about experimenting with, the chemical, but alcohol, because we're seeing a lot of deaths as it relates to alcohol. Is there, you think, abuse?
Yes, there's definitely alcohol abuse, which is one of the substance use disorders. And like you're saying, there consequences to alcohol abuse. There could be social consequences, there are health consequences, and you've mentioned a few. You've been seeing a lot of increase in road accidents due to substance misuse, due to alcohol abuse in particular. So it is indeed a concern for us, and it should be a concern for all of Guyana.
What's other substances in Guyana we need to look out for?
So traditionally in Guyana, substances that are misused are alcohol, tobacco, and also marijuana. Those are the traditional substances that we saw people misusing. However, like we mentioned earlier, we've noticed that there are new emerging trends and drugs being used in Guyana, such as ecstasy, or some refer to it as Molly.
Okay, so what we'll do, we'll take a break, and when we come back, we'll have more for you on health matters. And don't go away, we'll be right back.
What do you call it? Cold one, hard stuff, booze, liquid courage? The list is long, as is the list of its effects on the brain and body. We know the behavioral changes, we've seen it before. Slurred speech, changes in mood, unsteady walk, or even total loss of consciousness. It can cause other bodily damage too, like damage to your heart muscle, high blood pressure, stroke, liver damage, immune system suppression. It's also a known risk factor for cancer. Those are just to name a few. What about the people around you? Alcohol can influence domestic violence and cause road fatalities. Don't cause or become a statistic. Stop, think, don't drink. A message from the Ministry of Health Chronic Disease Unit.
As mentioned, we've got also with us Miss Avril Brands, Senior Prevention Officer. What is the strategy here, Ms. Brands? What is the drug unit's, goal in terms of prevention?
Well, there's the saying, prevention is better than cure.
Absolutely.
Great. And so in an effort to have a lot of prevention activities roll out, we do a lot of capacity building and awareness training. When we talk about awareness training, we're going to talk about going into the schools and helping the children to be aware of the risk factors and also the protective factors that they have right in their area, whether it's in their school or at home. Right? With the capacity building, we go to various regions where we roll out training to teachers, social workers, those persons that children are likely to come in contact with our adolescents. Where we do that is so that, they can be able to identify when that individual, that child, that adolescent is using, and to be able to chip in wherever necessary, if it is that they're going to maybe do a brief intervention at some point, or if they're going to refer. So, of course, in our training, we help them to identify those areas and to be able to move forward.
What are some of the messages you would normally leave, depending on the regions?
Well, yes, depending on the regions, because every region has their different makeup. So we would, some of the message would be, say no. One of the things we're telling students is to just say no. I know it sounds funny, but there are times when you have to work on their refusal skills when you do that. So when we tell them just say no, it's basically not to linger, because a lot of times when you linger, there's an opportunity for you to change your mind. So we're trying to get them to understand that there are times when you have to just move. So one of the messages we have there is just say no, and to develop themselves, be aware of who you are.
Doc mentioned something, and because of certain crises, it goes beyond health, especially as he mentioned that they tend to use these substances as coping mechanism.
Yes.
So how do you reach out now to things like mental health issues and other environmental factors that trigger the use and abuse of drugs?
Okay, so a lot of times you have to work on that child or the individual understanding themselves, as I said before. And so one of the things we do is work on their ways of coping, give them different coping mechanisms and stuff so that they can use it when they're in a crisis.
If I may add, Nazim, to Ms. Brand, so the ultimate goal for our drug prevention program is to ensure that our young people or an individual does not start. data would have shown us, research would have shown us that seldom you would find an adult starting to use a substance when they're old. It's usually when you're younger and you develop a particular habit. So at the end of it all, the final outcome, we are trying to reduce that incidence through behavioral change. And that's why I spoke of social norms earlier when I said at most social events, we find alcoholic beverages and other psychoactive substances being served. And that has become a social thing. You don't have a good party if you don't have an alcoholic beverages served, and that's the mindset. But that's what we need to change. And we know behavioral change takes about 3 to 5 years. So this is something that we have to continuously work on. Miss Brand spoke of coping mechanisms and so on. So I would just like our young people and the general population to leave or to find more healthy coping mechanisms. There are other coping mechanisms that you can use, like listening to music, going to the park for a walk.
Meditation.
We gotta engage them in sports to ensure the lungs are okay, right?
Yes.
And it's absolutely necessary
Yeah.
for us to involve the other agencies, the other ministries, because this needs to be a multifaceted approach. This needs to be a collaborative work between the Ministry of Health, Ministry of Education, Social Protection, sports. So and as the old adage would say, it takes a community to raise a child, and that is what we need to ensure that our population, and particularly our target population, which are the in and out of school youths, the young adults, we have to ensure that we give them the resources to prevent them from ever experimenting with one of these substances.
Right. Today's adult drug user was once again school youth, right?
Yes.
Yes.
So let me go across now to treatment and to Mr. Hunt, National Trainer of Drug Treatment. I just want to ask here a question. Is addiction playing a major part here? Once introduced, what is your findings?
Before we actually deal with that, I would like to comment on the prevention program, particularly dealing with young people. So one of the things that we focus is training young people in, life skills. Things like, the way how they make decisions, critical thinking, how they resolve conflicts as well, right? And another focus too is changing their perception of, using substances by creating awareness about, how it's going to damage, their bodies. So when you tell the person, okay, like, smoking marijuana basically affects, your lungs, and you show them, what, that lung look like. Basically, you change their perception so that if the temptation, even if peer pressure is there, well, that is not for me.
Your treatment program that you would have here in your trainings, and talk a bit about treatment.
Well, many persons have been using substances for years now. For example, imagine a man consuming high wine, which is a very potent, the drug content in high wine is very potent. That person was using that like for about 3 decades. So then imagine what's going to happen to his liver, right? So helping a person, so most times when I see, persons like that, is when they reach a crisis, a health crisis. Maybe they end up with a seizure. They have to be hospitalized. So in that case now, they treating them in a holistic way. So they go to the hospital because of the seizure. But then the doctor there realized that, the reason for this seizure basically is consuming alcohol. So at that time now, many persons are receptive now. Okay, I need to change this behavior. I need to, to change. And in bringing about change, they have to, in terms of changing people, places, and things. So if I'm drinking high wine every day with you and I want to change, that means I need to change the people who I drink with. So one individual told me, he said, Mr. Hunt, that is very hard because those persons that he drink with is a part of his social support, right? But with treatment, we help people to make those changes, help them to identify, their triggers, how to deal with their triggers, right? How to prevent, relapsing, right?
That's a key because many times people go back. They come out very well, they're liberated. What would sometimes cause them to go back?
Well, they might encounter stressful circumstances in their life. For example, one individual, I had a conversation with him. And he told me the reason why he started drinking is because his wife left him. She went to America and she never really returned. So then to cope with that pain, that psychological pain, he self-medicated by using liquor. And really and truly, it destroyed his life.
Mm-hmm. So very quickly, training. What when training or treatment, what it entails?
Well, training a person who have a substance use disorder, right? It's a specialized sort of training, because remember, we want to change our behavior, and the drug will impact the person biologically, that is their physical health, psychologically, their emotional and mental health, and of course their social relationships, right? How they interacted at the workplace, in the family, at school. So if you notice, there are 3 areas, and some people even say there's a 5th area, there's spirituality. One program, the 12-step program, basically touches on that, really, where you recognize a superior being and you commit yourself to that being to help you through that, that process. So training healthcare providers. The training is about helping persons to perform at the international standard. The standard must also be evidence-based. So if you go to Trinidad, Barbados, or wherever in the world, basically you're performing at a standard. Some years ago in Guyana, many persons came back. They were sent back to Guyana as deportees. And then all of a sudden, those persons now who would have went through therapy in America or wherever they came from, and then in Guyana now, they are passing themselves off as drug counselors. So there are ethics that a person must observe, right? So the training basically is to help people, to get the best care, so that they could break this habit of, substance use disorder.
Right, so we'll take a break. We're talking to members of the Drug Demand Reduction Unit of the Ministry of Health. We'll be coming back after these messages.
It may seem common for young people to experiment with different substances, like vaping, weed, tobacco, Molly, and alcohol. Some may even consider hard drugs such as cocaine, meth, or opioids like heroin. Regardless of the substance, if it's not prescribed by a doctor and taken as prescribed, experimenting with substances can have negative effects. Meet Jeremiah. Jeremiah hangs out with his friends on the weekends. They drink alcohol and occasionally smoke marijuana to relax and get away from the stresses of life and school. One time at a party, Jeremiah smoked something a girl handed to him, not knowing what it was. Later, he found out that it was K2, a synthetic type of weed. His friends told him that he was hilarious and started acting crazy, and that they couldn't wait to party with him again. Jeremiah was concerned because he has no memory of what happened. He wants to be with his friends and have a good time, but he hated not remembering and doesn't want to take another substance like that again. He also feels new pressure to be the life of the party and act a certain way. What happened to Jeremiah is all too common. You start out taking one substance and end up taking something else. A danger in using any substance that isn't prescribed to you is not knowing exactly what it is you're taking and how it will impact you. Unfortunately, young people are being exposed to substances that can have dangerous physical and mental health consequences. As a good rule of thumb, if a drug isn't prescribed to you, you shouldn't take it. Pretty quickly, what feels like casual or experimental substance use can turn into a substance use problem, which has long-lasting and negative consequences. Before you decide to use a substance, know the risks and potential consequences, or reach out to a counselor to talk about it.
All right, welcome back to our program where we're speaking on drug demand, and we've got members of the Drug Demand Reduction Unit of the Ministry of Health. Dr. Freeman, so obviously you're working in all 10 regions of our country, and I'm quite sure there's so many services offered with agencies within the government sector, and no doubt agencies out of the government sector. If you could enlighten us a bit about the work in the various services area.
Certainly. Thank you again, Nazim. So, like you would have mentioned, we do work with other organizations, other agencies. We work with our local partners here at Kanu. They're responsible for the supply aspect to the drug situation response. Also, we work along with the drug treatment court. There's an adult drug treatment court and there's a juvenile drug treatment court in which we support. And our international partners, such as the PAHO WHO, who gives the department a lot of technical support. Also, we work along with CCAD OAS. As it relates to services, I'm elated to announce that we have drug treatment services at the Georgetown Public Hospital and also at the Drug Demand Reduction Unit on Quamena Street. We are sharing the same building with the Mental Health Unit. So we do have services, drug treatment, specialized services at those facilities. We intend to expand our services to other regions for which Mr. Hunt, who you just spoke with, will be responsible as the master trainer for drug treatment specialists throughout all 10 administrative regions. So shortly, you will be able to access these services in other regions outside of Georgetown. Actually, that's one of our goals, Nazim, to provide universal healthcare services for persons who misuse substances. And we foresee by the end of the first quarter next year, we are going to be well equipped with drug treatment and drug prevention specialists in all 10 administrative regions.
Very quickly, you're talking about all the sectors, and you may find that some people who are on substance and substance abuse would have other health issues also to deal with. Do you make referrals and do you cater for those persons, like maybe having TB or diabetes or whatever, as the case may be?
Most definitely. We have a very robust referral system, and apart from that, we work along closely with the mental health unit and the psychiatric department, with the reason being oftentimes you find dual diagnosis with persons who might be using a substance and persons who have developed substance use disorders. So we work along with the other organizations. And speaking of working along with other organizations, we also work along with 2 non-governmental organizations who play crucial role or critical role in treatment and rehabilitation. And those 2 organizations would be the Phoenix Recovery Project and the Salvation Army, who the government, through the Drug Demand Reduction Unit, gives a lot of support to.
Very quickly, Mr. Hunt, do you see success stories?
Yes.
Quickly, tell us.
Particularly like young people who might, then now experiment with a drug. And working with them to see that, this is the wrong path. and to reshape their goal so that they now could become a productive member in the society and connect to being somebody.
Have you come across success stories?
In the training, I would talk about the response you would get when someone is not aware. Like, so we did a training in one of the institutions where we spoke about what drinking and smoking does to the sperm. And you could see naturally that the young men who attended that session, because it was all men, had no idea the what damage that using substances cause to their body. Right? So that when it comes to prevention, we do those sessions as I said before. So that would be one of the things where you're definitely raising awareness right there. That would be my success story.
Doc, you've got 50 seconds to end it off.
So, as it relates to success story, we are always elated to raise awareness and to see that there's so much persons speaking out now about substance use and substance misuse and the consequences, and also to see that the government of Guyana is supporting the drug demand reduction program and also addressing mental health, for which drug use is a risk factor. So that in its own, Nazim, is a big plus for us, and we're looking forward to continue working with the general population and the particular target groups.
And how can people contact you?
So they can contact the department with telephone numbers 223-6626. That's 223-6626 or 226-1402. 226-1402.
Thank you very much for being on our program. Today we've had members of the Drug Demand Reduction Unit of the Ministry of Health, and we'll be talking about in observation of International Day Against Drug Abuse and Illicit Trafficking. Thank you for being with us. Just remember, a second dose of booster shot is out for COVID-19. Please visit your nearest health center to get that. I'm Nazim Hussain. Thank you for being with us. Do join us again next time. Until that time, stay safe.